The Alabama Hospital Association says it's working to address a health care coverage gap affecting thousands of people, leaving many of them without health care coverage.
Yeah, officials say this is caused by the state's health care program, which has not yet been expanded. News 19's Daryl Burke joins us now live in the studio with more on the call to expand Medicaid and how officials are working to actually close that gap.
That's right, Jerry, Emily. An estimated 300,000 people in Alabama are working without health insurance. That's according to the Alabama Hospital Association. The AHA says that's because they make too much money to qualify for Medicaid, but they also don't make enough money to get private insurance. There are many working Alabamians living without health insurance, with thousands across the state finding themselves in this unique situation. This is partly because Alabama is one of 10 states that has not expanded Medicaid to adults without children or disabilities.
Unfortunately, a lot of the people in the coverage gap are working Alabamians. So they make too much for Medicaid, but not quite enough to afford private health insurance coverage on their own.
Parents or caregivers in Alabama must make less than $4,000 annually to qualify for Medicaid, meaning those without dependents or disabilities do not qualify. Debbie Smith with Alabama Arise says there is a range of benefits for the state if it were to expand Medicaid.
The federal government is going to give us more funding in order to run that program. It's also going to create jobs, about 20,000 new jobs in the state, and save us billions of dollars. And of course, increase that workforce participation rate.
Smith says investing in Alabama's health could mean big payoffs in the long run. That's because she says when people in the coverage gap go see a doctor, it ends up costing hospitals thousands in uncompensated care. The Alabama Hospital Association has been tasked with designing a plan to close the gap. Dr. Don Williamson with AHA says they're not pursuing a traditional expansion of Medicaid, but more so a design plan that will align with the specific situations Alabama is experiencing.
What we're looking for is an Alabama solution to an Alabama problem, and doing that using unique circumstances in Alabama that let us take advantage of coverage that we already have in the private sector, in the public sector, and bring those together.
With more than 250,000 people in Alabama working without health insurance, Williamson says they know the positives that can come out of expanding Medicaid.
Overall, there are some huge advantages to closing this coverage gap. Number one, if you look at states where that's been done, the health of the citizens improves. Cancers are diagnosed earlier, diabetes is diagnosed earlier, and patients are healthier.
Now, as we continue to follow those expansion efforts, for those in need of medical care without health insurance, we'll provide a list where you can still get health care that can be found on our website at WHNT.com.